Hello, I'm Brad Boeve. I'm a neurologist and sleep medicine clinician at Mayo Clinic in Rochester, Minnesota, and I'm speaking on behalf of the NAPS Consortium. And I'd like to talk about how those participating in today's webinar can get more involved. I apologize that I'm traveling today, and so I can't be here in person at the time of this meeting, but hope this is proving to be informative. And let me begin, though, by a slightly different topic. How can any of us potentially impact our future health? And for those who aren't aware, as it relates to dementia, this article came out a few years ago in the Lancet. What are potentially modifiable risk factors for reducing the risk for dementia? And we think many of these are also relate to Parkinsonism, although it's not as well proven. And these investigators reviewed the literature and mapped out these factors that all can reduce the risk, promote education in early life. For those on this webinar, we're very likely in midlife or later life, and things that we can impact if we have hearing loss, get hearing aids, try to minimize brain injury. If one has hypertension, have this treated, minimize alcohol intake, try to reduce weight, avoid smoking, treat depression, engage in social activities, be involved in physical activities, avoid air pollution, which is easier said than done. And if one has diabetes, try to treat this too. In addition to this, since 2020, more and more literature has suggested the Mediterranean diet or MIND diet that is also effective at reducing risk. And if you add these together, potentially modifiable factors amount to about a 40% risk reduction. And when one considers that most medicines that have ever been developed for any type of treatment, medical disorder, if they improve the condition by 20 or 30%, that's a pretty good drug. And so this really underscores that we can do a number of things. Now, not all of these are easy, but we can do a number of these things to try to reduce the risk for dementia. Now, turning to how can those involved in this webinar and interested in RBD get more involved? First of all, participate in research if you're not already doing so. Consider volunteering to participate in a NAPS focus groups, and we have many. Consider serving on an ad hoc NAPS committee, focus on education and awareness or promoting diversity engagement. Assist in reviewing NAPS-related educational materials, and there are many of them and more coming. Volunteer to be interviewed as a voice for RBD in NAPS or any other research program. Consider forming a patient advocacy organization or group, and these are abbreviated POWs or PEGs focused on RBD, and I'll talk more about this in a moment. An important aspect, and some people are a bit bashful to do this, but this can be quite effective, especially a collection of individuals who do this, contacting elected officials and advocate for more support for RBD research, awareness, and education. A little bit more on patient advocacy organizations. What is a POW or a PEG? This is a nonprofit group that represents patients and families affected by a significant medical condition or disease. And there are many examples as listed here, and I'm sure you've heard of most or all of these: American Heart Association, American Cancer Society, Alzheimer's Association, Narcolepsy Network. Some that are especially more pertinent to RBD-related activities: the Parkinson's Foundation, Lewy Body Dementia Association, the MSA Coalition. What do these, or what could a PEG focused on RBD do? And I should also state that each of those organizations that I just listed and all others, they always begin with a very small group of people, 5 or 10, that band together, for a common cause, and it takes usually years to really get the ground running, engage more people, raise money. And some of these organizations, for example, the Alzheimer's Association now has millions of dollars in grant funding. They lobby Congress on behalf of people with Alzheimer's disease and related disorders. So there's a lot that can be done, but it does take that initial seed to start the organization in the first place. So a PEG focused on RBD could advocate for awareness and education on RBD for the public, for healthcare providers, for industry partners, and others. It could provide support for those affected by RBD. And we've learned a lot from our own patients, the techniques that they've learned to try to minimize nightmares or injuries related to RBD. We've learned about melatonin, clonazepam. There are some people who don't get a good response from either or both of those, and we've learned from many patients what has worked for them. So this is an important part of support for those affected by RBD. Advocate for more funding for RBD research, and advocate to federal agencies for targeted attention focused on RBD-related concerns. And what I'm specifically focusing on here is organizations like the Food and Drug Administration. I was in a meeting a few years ago, and the focus was on Lewy Body Dementia Association, and there was an FDA official there, and he was commenting on how rare Lewy body dementia is. Well, it's not rare. It's as or more common than Parkinson's disease, but for whatever reason, he wasn't aware of the prevalence being high. And we know the prevalence of RBD is as much as about 1% of adults. So this is very common, and we need to educate FDA officials, Medicare officials, and the like. So with that, I appreciate your attention, and I'll stop there. And thank you also for participating in this webinar.